Hi, good morning, Jason. I know you're coming to the office for this asthma exacerbation. I know you have been suffering from asthma since you were a kid, but it's always being mild. But this time, because of this exacerbation, we need to prescribe prednisone. And I would like to talk to you about prednisone a little bit, give you some information, general information. Prednisone is a type of medication within the group called corticosteroids. It's a systemic anti-inflammatory medication used to treat a variety of diseases, including allergic reactions, immune disorders, and asthma, of course. As you probably know, asthma is a chronic inflammatory disorder, but from the airway. The dose that you're going to be taking will be 20 milligrams 2 times a day for 5 days, no refills. It's a very short period, a short treatment, so you should be fine. But let me just talk a little bit about this. In normal circumstances, our body produces cortisol, which is a glucocorticoid secreted by the adrenal glands located on top of each kidney. These adrenal glands, in conjunction with the hypothalamus and the pituitary gland, which are both located actually inside the brain, they together control the secretion of steroids inside of our body. Now, the administration of exogenous or like external corticosteroids affect the internal mechanism, leading sometimes to some complications if not taken as prescribed. The way that the corticosteroid works, they are well known for having a direct influence in the metabolic system, anti-inflammatory and growth suppressing effects. Like I said before, cortisol is an steroid known as the wake-up hormone. When an imbalance occurs, the sleep pattern might be altered, causing some changes in the degree of awareness. Disruption of the normal corticosteroid balance due to like external administration might affect the body like in a different ways, like causing some emotional changes. Can also cause like metabolic disruption, sometimes increasing blood sugar. When it comes to cardiovascular system, you can experience increase on the blood pressure, some swelling. So this is the way that the medication alters the body. The way that the medication works in the body is when we administer like either orally or injection, but orally, which is your case, the medication is absorbed in the small intestine and in the upper jejunum specifically. The medication is metabolized by the liver and is excreted or taken out by the kidneys. This medication has a few adverse reactions. When using corticosteroids, you can experience irritability, mood changes, agitation, insomnia, and sometimes severe depression. But this is with like long-term, like extended treatment. Like I said before, hypertension, hyperglycemia, osteoporosis, those are, but when they are used for a prolonged time. Just in case, if eventually you need to use this medication like over the time, just to give you some general information, like in elderly patients, the metabolism has changed, so the absorption, excretion are usually slow, which can lead to increased concentrations in the body. Systemic corticosteroid can cause confusion, agitation, changes in glucose metabolism, like I mentioned before, and also can produce initial swelling, weight gain. You can feel more tired than normal, some visual disturbances, and behavioral or mood changes. Also, if it happened that for any reason your kids eventually there is any need to take this type of medication, one of the main concerns is always adrenal suppression with consequent growth disruptions. Also, in kids, vaccination should be avoided while taking corticosteroids because the risk is like the same risk that you can see in elderly. Also, kids, they can experience weight gain, increased glycemic levels, stomach upset, nausea, vomiting, and some swelling. Also can experience some mood swings and difficulty sleeping. Most side effects, like I said before, especially hormonal and immune system problems, are worse with long-term use of prednisone. It's likely like with less likely with short-term, which is going to be your case. Again, I just send the prescription to the pharmacy. You're going to be receiving a bottle with only 10 pills. The durations are on the bottle. If you have any question in the future, or when you start taking the medication, you experience some like symptoms that you think that it's not normal, there is something like different on you, just give me a call, please, and we can go over the medication, readjust dose, look at the treatment. But let's get started and see how it goes.